Hey everyone, it's Amberly. So today I wanted to talk to you about a topic that I am all too familiar with. It's multiple sclerosis. Now, multiple sclerosis, or MS for short, is an autoimmune disease where your immune system, which usually attacks bad cells, gets confused and it starts attacking good cells too, mainly the myelin sheath around the nerves. The myelin sheath is a sort of insulated tubing around your nerves that allows nerve impulses to jump quickly from nerve to nerve. When the myelin sheath is damaged, it can cause a lot of weird sensations, and it makes nerve impulses traveling very difficult. MS has a bunch of symptoms. No two cases of MS are rarely ever the same. Some of the symptoms almost always include fatigue, extreme fatigue, numbness and tingling, usually of the limbs. I get a lot of tingling and numbness in my legs. Sometimes it feels like there's a big bug, like crawling rapidly down my legs, which kind of makes me gasp, which I've done in public, and it's terribly embarrassing. You can have walking problems, such as limping, which I limp. You can have balance problems. There's marked clumsiness. I drop things all the time. And there's even some rare cases where you can stutter or slur your speech. You can have cognitive problems with memory and the ability to find the right word. I've forgotten how to do math on several occasions. One instance was I went to the post office to buy one stamp, and I knew the stamp was 48 cents and that I had 53 cents with me, and I'm looking at the change and I'm going, okay, a quarter is 25, a dime is 10, but I couldn't add them together. Sometimes you have writing problems. I had to take several oral exams in college because I could not write. I also used to be able to do really exquisite nail art, and now I'm lucky if I can get a base coat on. Your hands shake a lot. You have tremors, spasms, just lots and lots of pain in general. You get stiff, especially if you're exposed to high temperatures. It's called Uhthoff's syndrome. So if I take a bath that's too hot, or if the weather changes and I get too hot, I just crash. It's, you just get really stiff, really tired, you just want to sleep because you're just in so much pain. Some of the other key symptoms are optic neuritis, which is when you can lose vision in your eyes. Things can look blurry or double visioned. Sometimes you'll get big gray spots in part of your vision in one or both eyes. You can go blind for a couple days. Most of the time you'll get that back, and sometimes you won't. You can also face paralysis. When I first realized I was having symptoms of MS, I could not feel anything from the waist down. My legs felt like they were on fire. They were swollen, like I had giant hairy spiders under my skin, just like trying to get out. And I could not walk. There are just numerous symptoms 2 to 5% of MS patients can develop seizures just depending on where the lesions are in their brain. I happen to be in that 2 to 5%. And the other two main ways to tell if you have MS, well, there's the optic neuritis, of course. There's ovoid brain lesions. There are 4 areas in the brain. They're called the McDonald's Criterion areas, that if you develop ovoid lesions in those areas of the brain, it's likely that you have MS. I have 9 brain lesions in 3 out of the 4 McDonald's Criterion areas. You can also develop spinal lesions. Usually it's in the upper spine, the cervical spine. Sometimes you may get thoracic spine lesions, which is the middle of your back. Very rarely will you see lumbar lesions, which is the very lower portion of your back. Other symptoms can include a lot of emotional problems. You're used to be able to doing anything you wanted, and then suddenly you're so limited that it does cause frustration, depression. I feel a lot of anxiety because I'm so young and I don't know what my future is going to hold. Some people can end up in a wheelchair. Some people can be severely disabled by MS. I already use a cane. If I go to Walmart, I use the scooter. If we go to one of the malls, Ken will push me around in a wheelchair, which is embarrassing. It gets me a lot of dirty looks. I think some of the people there think I'm just taking the scooter for a joyride or I'm lazy. I have a permanent handicap placard, which also gets me some dirty looks because they think I stole my grandma's or something. There are, fortunately, a lot of treatment options now. They've come out with disease-modifying drugs, immunosuppressant drugs, such as interferon. There are some interferons that you can take daily, subcutaneously, or intravenously. There are some that you can take bi-daily, every other day. And there is one called Avonex, which I was on, that you take weekly, but it has to go intramuscularly. And basically it makes you feel like you have the worst flu of your life for about 36 hours. So I was in college, and I would get my shots on Fridays, and I wouldn't feel okay until about midday Sunday. So I got no homework done over the weekend. I was like just tired and crashy, and it made things really difficult. So I decided that I would forego the interferon while I was in college. Other ways you can treat the symptoms, if you have a flare-up, you can get steroids. I've had steroid injections into my spine 4 times. I've had over-the-counter steroids such as prednisone. And during a particularly bad flare about 2 years ago, I had solumedrol, which is a steroid that you have to take intravenously. It took 2 hours to completely absorb the drug. I had a home nurse come to my house for 4 days at the age of 21. Other ways you can treat the symptoms, physical therapy. If you happen to have extreme weakness or foot drop, like I did, then you can go to physical therapy and try to strengthen yourself back up. You can also treat the symptoms with different medications, which is the route I'm on now. You can get muscle relaxers, painkillers, Neurontin or Gabapentin, which helps reduce some of the sensory problems such as the tingling and numbness. A lot of MS patients end up on antidepressants. I'm on one pill that helps me with the seizures, and there are a bunch of different kind of pills that you can be on. You can be on sleeping medication. I was on Ambien for a while because you're so tense all day that when you try to go to bed and your body is relaxing, you just have spasm after spasm, and it keeps you awake all night. So there are actually 4 different kinds of multiple sclerosis. The most common one, which is what I have, is called relapsing-remitting. It's when you have a flare-up, and then it goes away, and you're pretty much back to normal for a while until the next flare-up. Primary progressive MS, which is where you have a flare-up, and then you don't quite go back to normal. It just keeps getting worse and worse each flare-up. There's also secondary progressive, which before interferon and immunosuppressant drugs, about 50% of MS patients that had relapsing-remitting MS would develop. It's where, again, sort of like the primary progressive, where you have a flare-up, but you don't quite completely get back to normal. So the next flare-up is worse, and then you don't quite completely get back to normal. But it's not as severe as the primary progressive. The last type of MS is progressive-remitting. Only about 5% of MS patients have this kind, and it's when you kind of never get back to normal. You have a flare-up and you kind of stay there, and then you have another flare-up, and it never really quite goes away. You never quite ever get back to normal. Unfortunately, MS has a lot of different symptoms, a lot of different forms. Of course, you can get the testing. You can get brain MRIs or spinal MRIs. Optic neuritis can show up on an MRI. They also have tests called visual evoked potentials that they can check your eyes. You can also have a lumbar puncture, and they'll check the CNF fluid for oligoclonal banding. I've had a lumbar puncture, and I didn't have oligoclonal banding, so I was pretty fortunate. But it is so varied, but yet so precise in a way. It just takes a very long time to diagnose, because say you have brain lesions, but you don't have any spinal lesions, or you don't have optic neuritis, or say you do have brain lesions, but they're not quite ovoid. It could be caused from migraines. It could be caused from a bunch of different neurological aspects. Say you have optic neuritis, but you don't have any lesions. Say you don't have anything, but you get a lumbar test and you have oligoclonal banding. So it's kind of just like a wait and see kind of process, where you have to kind of wait to go blind or develop brain lesions or go into a flare-up. You have to have at least 2 different flare-ups divided by space and time. They have to last for at least 24 to 48 hours. And that is the first step towards getting diagnosed. My issues started in 2009. I was working 2 jobs, dual enrolled in college while I was in high school, doing very well. And then I got a bulging disc in my spine, and my legs started hurting very badly. So they thought, okay, it's because of the bulging disc, there's pinched nerves. So for the next year and a half, they were trying to work with my spine and putting me on all these different medications that just didn't seem to be working. The bulging disc had gone away, but I was still having all of this leg pain, and they couldn't really figure out why. And then suddenly my hands went numb. I woke up, thought they were asleep, but they didn't wake up for several hours. And that's when my family doctor suggested I get a brain MRI, and they found the lesions. I had had instances of blurred vision. I had the brain MRIs, I had a lot of the symptoms, and in November 19th of 2010, I was diagnosed with MS. I was kind of fortunate to be diagnosed so early, but up until that point, I had thought, they can fix this. It's a spinal issue. They can give me a pill or they can do like a surgery. And then suddenly it wasn't something that could be fixed. I did a lot of the research, and of course, you talk to people and say, they ask, why are you limping? Did you hurt your leg? And no, I have MS. Oh, my friend's mom has MS. But I mean, she's in a wheelchair. She's 40 though. And that's really scary. That's not always the prognosis. You can live completely normally for your whole life, except for the occasional flare-ups, but other cases you can be bound to a wheelchair. You can need help bathing. In severe cases, you can experience incontinence, so you're peeing and pooping yourself, which is terrifying. You can also have a lot of sexual dysfunctions. It's a very scary thing. And to be diagnosed so early, usually the older you get, the more time you've had to be normal. So if you get diagnosed when you're maybe 35, it's not usually as bad, but to be diagnosed at 20, it was really, really very early in my life, and it was really scary. But luckily, I could get on interferon quicker, so that it might have a chance to reduce a lot of my problems. There's a lot of lifestyle choices you have to make. I have to be careful overdoing anything. I can't walk a lot. I can't run. I can't jump. It's hilarious to see me doing jumping jacks. I can't pass a field sobriety test, even if I'm 100% sober, which I am all the time. I would just fail. And it's difficult to try to convince an officer, yeah, I'm 23, I can completely go to the bar and get smashed, but I'm not, and I can't pass a field sobriety test. You have to kind of set up safety equipment. You may need extra handles, extra railings, places to hold on to, make sure that there's nothing laying around on the ground that you could trip over. And sometimes you might need, like a chair for the bathtub or the shower. Ultimately, you have to have at least 2 of the 3 central nervous system issues to be diagnosed. So that means optic neuritis and brain lesions, or brain lesions and spinal lesions, so on and so forth. So that's as much as I can talk about MS in general. There's a lot more things that you could do research on. That's sort of my story with it. It's not good times, but you gotta make the best of it. It's frustrating. It really is, because I would never voluntarily want to climb Mount Everest, but now that, I can't, that option has been taken away from me. It's really just not fair. I feel like it's unfair. And I used to be able to go bowling, I could go ice skating, jogging, bike riding, and I really can't do those things anymore without paying for it and a lot of pain. 2 days ago, I shoveled snow. It's winter here in PA, and I needed to shovel my car spot out. Yesterday, I woke up feeling like I'd been hit by a train. I was sore everywhere. I couldn't lift my arms very well. I still can't lift my arms very well. Everything hurt. I had trouble walking. I was just exhausted from shoveling, that's something so many people kind of take for granted. I can't lift my laundry. My brother lifts my laundry for me. I can't necessarily go grocery shopping by myself because I can't lift the groceries. I have a lot of trouble lifting things. Whenever we go camping and I try to move firewood, I get yelled at. My pap yells at me a lot because I shouldn't be overdoing it. A lot of my family kind of gets on my case about overdoing it. And in a way it's nice, but in another way it's just kind of like a reminder that you can't do that. And as I said before, I drop a lot of things. I drop my lighter, my pens, my keys, all the time. And there's always somebody there, even at school, like my friends, or at home, my brother. They'll just pick it up for me immediately. And it's like, I could totally get that. You don't have to baby me. But I'm glad, in a way, that I have so much support in my life. I think people with disabilities, MS, they need that kind of support system. And while it is frustrating, because I've always been so independent my whole life, to now have to kind of swallow my pride and ask for help, I'm grateful that I do have that help. I hope you guys learned something today. I'm sorry if I got a little bit too much on a personal note. I wanted to be more informative, but the only way I feel like I could explain what a lot of this stuff means is to relate it to myself. And now you guys know multiple sclerosis. Thanks for watching, and I will see you next time.